whenever I take the class, there is the one thing that anatomy is very basic subject, and if our basic is weak, definitely all the other subjects will become weak. And right now there is our integrated pattern. Getting the point? There is the integrated pattern, and for this proper integration, okay, we will make with this integration. Yes, remember, anatomy is at the base, and all the other subject, you can say the physio, even the biochem, yes, even your patho, pharma, even you will see our microbiology, even you can see the medicine, surgery, yes, eye anatomy, ophthalmology, your ENT, even indirectly the community medicine, and our short subject skin anesthesia, radio, psyche, ortho, ops, gynae, and pedia. All the subjects are depending over the anatomy. Remember, our medical science starts from the anatomy and ends at the radiology, and medicine, pedia, ops, gynae, this all the subjects are in between. So if our basic subjects are weak, then definitely better remember our strongness, our strength in our medicine, surgery, pedia, ops, gynae will be weak. So our first target, we have to make this basic subject strong. Now the problem with the anatomy, whenever I am taking the classes in India and outside the India, एक छोटी सी complaint हर जगह के बच्चे कहते हैं, सर एनाटॉमी इज ड्राई, हार्ड, बोरिंग एंड द वोलेटाइल सब्जेक्ट। तो कुछ मजे लेकर के पढ़ते हैं, अच्छे से पढ़ते हैं, शायरिया सुनाते हुए पढ़ते हैं। यस, सो अर्ज किया है, यस यस यस, अर्ज किया है, शायरी सुना रहा हूं, जरा गौर से सुनना। अर्ज किया है, शायरी सुना रहा हूं, जरा गौर से सुनना, मुझे शायरी नहीं आती, किसी और से सुनना। ओके, सो जस्ट फ्यू फन, एंड विद दिस फन वी आर लर्निंग द एनाटॉमी। तो सबसे पहली चीज कि ये एनाटॉमी होती क्या है, कैन यू सी, एना प्लस टॉमी, सिंपल, यू कैन ब्रेक द वर्ड एंड गेट द आइडिया। यस, एना means to see and Tommy means cutting. Yes, but we are going to integrate with the clinical subject. आपने सुना है gastrotomy? Yes sir, gastrotomy. Tommy means cutting. If we are cutting the stomach, then it is the gastrotomy. आपने सुना है there is the hepatotomy? Yes, when we are cutting the liver, that is the our, yes, hepatotomy. In the similar way, whenever there is a term tommy, tommy means cutting. Yes, what is the meaning of the ana? Ana means to see. Means what is the anatomy? We have to cut and we have to observe. So when we are cutting and when we are observing, this is actually the anatomy, and in medical terms you can say this is the dissection. Everybody, if you are getting the point, then write down G. If you are getting the point, write down the G in your comment box. Yes, everybody, अगर आपको चीजें समझ में आ रही है तो G G G या फिर Y. Yes, if you are getting the point, yes, give the thumbs up, or Y. Yes, better, you all are correct. Yes, Alia, Shatabdi is here. Yes, Salini, liver cutting. Yes. Gas को काट दो, that is the gasotomy. But we are talking about the gastrotomy. Okay, yes. Okay, बेटा, फाइन। तो अब एनाटॉमी का मतलब क्या हुआ? वी हैव टू कट, वी हैव टू सी, हमको काटना है और हमको देखना है। गेटिंग द पॉइंट? अब सवाल ये है कि हमको क्या कट करना है। यस, वी आर स्टार्टिंग फ्रॉम द वेरी बेसिक्स। डू यू रिमेंबर एट टाइम ऑफ आवर स्कूल टाइम हम प्लांट की कटिंग करते थे। द प्लांट कटिंग वॉज नोन एज द बॉटनी, लेकिन अब हमें बॉटनी से कोई मतलब नहीं है। यस, वी वर कटिंग द एनिमल, दैट वॉज अवर जूलॉजी, सो वी are not talking right now about the zoology. Yes, we are going to cut the human body, that human body which is dead and preserved with the embalming procedure. फॉर्मेलिन का सॉल्यूशन होता है। हमारे एनाटॉमी डिपार्टमेंट बड़े बड़े टैंक होते हैं, आपने भी देखा होगा, वेयर दिस डेड बॉडीज आर सिंक। ओके, सो दैट डेड बॉडी विच आर प्रिजर्व्ड with the proper permission from the government, that is the cadaver. And remember beta, this cadaver, yes, what I want to tell you, this cadaver is the god for the MBBS student. Without this God, we cannot learn anything. Cadaver is the first teacher. Cadaver is the first teacher. Remember, this is the very important thing. अगर किसी आदमी ने अपनी बॉडी डोनेट की है, उसने अपनी आंखें डोनेट नहीं की है, उसने अपना हार्ट डोनेट नहीं किया, उसने लीवर डोनेट नहीं किया, उसने किडनी डोनेट नहीं किया, he donated, yes, he donated entire body. So remember this point. Any cadaver is first teacher for us. Without it, we cannot learn anything. Yes, you are looking the different kind of the arteries. You are looking the different kind of the structures. Ophthalmology की शुरुआत भी बेटा यहीं से होती है. Yes, we are taking the help of our three-dimensional anatomy. So, when you want to be get mastery for the ophthalmology, yes, you have to know each and every structure. बेटा ये भी कौन बताएगा? एनाटॉमी बताएगा. कौन सिखा रहा है? कैडेवर सिखा रहा है. सो रिस्पेक्ट द कैडेवर. So these are the basic things which each and every doctor must know, MBBS student must know. Okay, so what I want to tell you, yes, we are going to learn the cadaver, and you can go for the any textbook of the anatomy. It is writing the human anatomy. It is not the plant anatomy. It is not the zoology. This all. So remember, we are going to cut the human body. So now I am putting the example cutting of human body. Basic concept. Okay, everybody, if you all are getting the point, then please put yes or why in the comment box. Yes, why in the comment box. Everybody, you are getting the point? Okay, yes, thank you Rahul, thank you Ritesh, yes, Nitish, thank you, yes, thank you everybody. So you all are getting the point. So we had shared one PDF where this diagram is there. I'm going to draw this diagram for all of you for proper understanding. Okay, this will create the basic concept. Yes, thank you Kiran, thank you Nikhil, thank you Medical, yes, Dr. Rockstar, everybody, thank you. Yes, suppose we are going to cut this arm. We are cutting the arm. So when we are cutting the arm, how it will appear? What is the anatomy? Yes, kato or dekho, that is the anatomy. Cut and observe. So when we are cutting this arm, then you will see it is rounded in nature. So quickly, this is the rapid revision. So I am drawing one quick diagram. Suppose this is our shape of the arm. Yes, it is rounded. So can you see? This is outer layer. Can you tell me the outermost layer in our body? Anatomy beta dekh karke padho. No need to mug up. Dekho apne haath mein. The outermost layer is, yes, this is skin. Agree everyone? Got the point? Now just below the skin, there is a collection of the fat. Just below the skin, there is a collection of the fat. This collection of the fat is known as fascia. Yes. Okay, yes. Thank you everybody. So with your all the love and the support, 814 students have joined. Yes, beta ye बहुत ही useful session है. Please share this link to your all the friends, all the MBBS students, all the FMG students, all the NEET students, any student who is in the first MBBS, even for them this session is going to be very useful. Okay, and you will enjoy. बीच बीच में हम शायरिया करते रहेंगे. ये जितनी भी चीजें हैं बहुत ही प्यार से एक आइसक्रीम की तरह आपको टेस्टी लगेगी, पिघलती जाएगी और आपको इसमें मजा आएगा. Anatomy will not be remain the boring subject. It is very interesting. Okay, yes बेटा. So outermost layer is the skin. अब याद करो फर्स्ट एमबीबीएस का डाइसेक्शन. आफ्टर कटिंग द स्किन, जस्ट बिलो द स्किन देयर वाज द लूज कनेक्टिव टिश्यू लेयर विथ हाई अमाउंट ऑफ द फैट. फैट को हम येलो कलर से ड्रॉ कर रहे हैं. दिस इज योर लेयर ऑफ द फैट. यस, दिस इज सुपरफिशियल फेशिया. सो दिस इज अवर सुपरफिशियल फेशिया. एग्री एवरीवन? Now when you will remove this superficial fascia, there will be, yes, very good Dr. Priyanka, this is the fat. There is another layer of the fascia which is having rich amount of the collagen. That is your, yes, deep fascia. So you will get another collagen layer, that is your deep fascia. So we are drawing one another layer. This is our highly rich in collagen. तो बेटा ये क्या हो गया आपका deep fascia. Now you know the innermost layer. Innermost layer touch करो. Yes, skin is there. Then superficial fascia and then deep fascia. The innermost layer you will get, that is your bone. Humerus is there. Okay. So you can see these bones are having attachment with the मसल, यस, हड्डियां किससे जुड़ी हुई होती हैं? मसल से जुड़ी हुई होती हैं. सो यू कैन सी दीज आर आवर डिफरेंट मसल्स are attached with the bone. Getting the point? Yes, sir. So these are, suppose this is diagrammatic presentation और इससे बनेंगे. So you can see here the bones are attached in our body with the muscles. Getting the point? Okay. So now try to understand these are our muscle and deepest most structure is the, yes, you can say bone. तो बेटा कहीं कभी आप डाइसेक्शन करो, इफ यू आर कटिंग द आर्म, फोर आर्म, इवन द थोरेक्स, इवन द एब्डोमेन, इवन द थाई, एवरीवेयर यू विल गेट दिस लेयर. तो एक बार मेरे साथ बोलो, यस बेटा, इसकी आपको चैंटिंग करनी है, आपको मेरे साथ बोलना है. ऐसा सोचो कि हम और आप एक दूसरे के आमने सामने टेबल में बैठे हुए हैं, हम डिस्कस कर रहे हैं. यस, टेल मी व्हाट आर द 5 लेयर्स इन द बॉडी? स्किन, देन सुपरफिशियल फेशिया, देन डीप फेशिया, देन यू विल से द मसल एंड देन बोन. यस, काटो और देखो. If you are cutting the skull area, same layer you will see. What are the layers? Yes, again, beta, again speak with me. Yes, there is the skin, first layer. Second is superficial fascia. Yes, speak with me. Do chanting with me. Skin, superficial fascia, then deep fascia, then muscle, and the last layer is the bone. Yes, how it will help you in anatomy? We are going to see. See here. Now you can observe there is the formation of space. Yes, sir. There is a formation of the space in between. Can you see? Yes. There is a formation of the space. These are simply the fossa. These are simply the triangles. These are simply the different spaces. Yes. In our body, we are reading the triangles. Triangles of the neck. Anterior triangle, posterior triangle. Submandibular triangle, submental triangle, carotid triangle, so many triangle, so many confusion. We are reading about the cubital fossa. We are reading the anatomical snub box. We are reading about the femoral triangle. We are reading the popliteal fossa. Feel in your own body. But anatomy बस एक ऐसा सब्जेक्ट है जिसमें आप चीटिंग करते हो एग्जामिनेशन हॉल के अंदर. You are carrying the cheating material within the examination hall. How? Yes, you are carrying your own body. Our own body is the anatomy. And nobody can stop you to carry your own body in exam hall. Okay? Yes. आप anatomy के आंसर अपने बॉडी में खोज सकते हो if you are having the such kind of the way of study. So we are doing this one. Okay? So if you all are getting the point, then please give your thumbs up or give the why yes in comment box. Okay? Yes, everybody getting the point? So now we are going to look what are the different boundaries, of the our, yes, this fossa. Can you tell me? कौन बताएगा? Yes, this space is bounded by which structure? ऊपर जो है उसको हम कहेंगे roof. आप जिस कमरे में बैठे हैं बेटा, what are the boundaries? Roof is above, floor is below. Yes, एक तरफ आपको मिलेगा मीडियल वॉल, एक तरफ आपको मिलेगा लैटरल वॉल. फ्रंट इज द एंट्री वॉल, बिहाइंड इज द पोस्टीरियर वॉल. गेटिंग द पॉइंट? देयर आर द अवर डिफरेंट लेयर्स इन द बॉडी. गेटिंग द पॉइंट? ओके, जब भी आप कोई स्पेस के बारे में पढ़ते हैं, व्हाट आर द डिफरेंट बाउंड्रीज? यस, रूफ इज देयर, फ्लोर इज देयर, मीडियल वॉल इज देयर, लैटरल वॉल इज देयर, एंट्री वॉल इज देयर, पोस्टीरियर वॉल इज देयर. Getting the point? In the similar way, if you are looking this fossa, what are the different boundaries? These structures are making the roof. तो बेटा roof कौन बना रहा है? Can you see? This roof is formed by, yes, it is formed by the skin, superficial fascia, deep fascia. Am I right? Yes, पूरी anatomy एक बार में खत्म हम कर रहे हैं. All the boundaries, all the fossa we are completing in the one way. Okay, one time. Yes, see here बेटा. If anyone is asking about the roof of the carotid triangle, submandibular triangle, posterior triangle, cubital fossa roof, femoral triangle roof, popliteal fossa roof, what are the structures which are making the roof? Skin, superficial fascia, deep fascia. No need to mug up. कौन कहता है कि एनाटॉमी रटने वाला सब्जेक्ट है? बिल्कुल नहीं. Anatomy is the most conceptual subject. God created our body in a very beautiful way. If we will understand this God creation, you will get all the medical subject easy. बेटा किसी का भी अगर रूफ आया, anatomical snub box roof is asked, what is your answer? Skin, superficial fascia, deep fascia. Everybody getting the point? If you are getting the point, just give me the clapping. Yes, 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 yes. Just give me the clapping if you all are getting the point. Okay. Fine. Okay. Yes, 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 yes. Okay, very nice. I am getting your point. This thumbs up. Fine. Yes. Thank you. Thank you, Vipul. Thank you, Shiva, Kirti, Dr. Tanya. Yes. So we are proceeding. अब अगर बेटा रूफ किससे बन रहा है? स्किन, सुपरफिशियल फेशिया, डूप फेशिया. सो कैन यू टेल मी द फ्लोर इज फॉर्म बाय दीज स्ट्रक्चर. ये डीप में है. यस, फ्लोर इज फॉर्म बाय, you can see always the floor will be formed by these deeper structure. Yes, floor is formed by the muscle. You can see the muscle and you can see the bone. So muscle and bone. Yes, you will see in our detailed classes that muscle, non-contractile part of the muscle is known as tendon. मसल का ऐसा पार्ट जो कांटेक्ट नहीं करता, फिजियोलॉजी क्या कहता है? फिजियोलॉजी इंटीग्रेशन. यस, व्हाट इज द मसल? एनी स्पेशल सेल हैविंग द कॉन्ट्रैक्टाइल प्रॉपर्टी नोन एज द मसल. लेकिन मसल का ऐसा पार्ट जो कॉन्ट्रैक्शन शो नहीं करता, दैट इज द टेंडन. जब यही टेंडन चपटा हो जाता है, यस रिमेंबर द फ्लैट टेंडन इज नोन एज एपोन्यूरोसिस. सी विथ मी, फ्लैट टेंडन इज नोन एज एपोन्यूरोसिस. सी हियर एनाटॉमी इन योर ओन बॉडी. यस, जब आप हाथ को क्लॉ बनाते हो, सिंघम की तरह हाथ करते हो. ओके, आपने सिंघम का डांसिंग स्टाइल देखा है? अजय देवगन, द बेस्ट डांसर ऑफ द बॉलीवुड. ओके, आई एम जोकिंग. यस, when you are making the hand in claw manner, there is a cord like elevation. These cord like structures are known as tendon. बेटा आपको ये दिखेगा, यही टेंडन है. फाइन. Now what you have to remember? Yes, very good Dr. Ramya. Yes, Dr. Shamira, Alia. Yes, very good, very nice beta. Now what I want to tell you, these floor are formed by, yes, these are formed by the muscle and bone as well as tendon. Can you tell me boundary कौन बना रही है? Yes, you can see the boundaries are formed by this muscles as well as tendon. So you will say that boundaries are formed by, कोई भी स्पेस आप पढ़ेंगे तो boundary is formed by the muscle and the part of the muscle that is tendon. And what are the content? जब भी आप कंटेंट को देखेंगे तो बेटा आपको क्या चीजें मिलेगी? Yes, you will see there will be the vein, there will be the artery, and there will be the nerve. Always these are the content. So these all the contents are within the protection of the modified deep fascia. So this is vein. Yes, it is having the artery. Yes, it is having the nerve. How you can remember? You can remember this structure with the mnemonic of the VAN. Everybody getting the point? Yes, you can remember with the VAN. So what are the content of popliteal fossa? What are the content of the femoral triangle? What are the content of the any kind of the triangle? You can remember them with the mnemonic VAN. Yes. अब यहां से आपके क्वेश्चन कैसे आते हैं? See here, vein plus artery is known as vessel, and N for that is nerve. Okay. So this bundle which is having the vein plus artery, that is known as, try to understand, this is known as neurovascular bundle. What is this neurovascular bundle? Yes, in recent FMG exam, the question had been asked, the neurovascular bundle in abdomen runs in between. अगर किसी को आंसर पता हो तो आप इसको कमेंट कर सकते हैं. The neurovascular bundle in abdomen runs in between. Yes, it runs between the second muscle layer and the third muscle layer. Means internal oblique and transversus abdominis muscle. This is the recent FMG 2021 question. बेटा ये जो FMG एग्जाम है, ये जो INICET, एम्स है, नीट है, ये एक दूसरे से अलग नहीं है. आई एम टेलिंग यू द क्वेश्चन फ्रॉम द एम्स 2018. There was the one question. Yes, the neurovascular bundle is absent in which compartment of the leg? This is the INICET AIMS pattern. It is the old question. Remember, the questions which are asked in the INICET, they are coming in the NEET. And what are the questions which are asked in the NEET? They are asked in the FMG. And this all the questions which are asked in your INICET, in your NEET, in your FMG exam, they are coming from the first MBBS. Yes, if your theory is strong, if your concept is strong, then definitely any kind of the exam pattern, definitely you will crack. बट ऐसा कोई भी एग्जाम नहीं है जिसको कॉन्सेप्ट के बेसिस में नहीं तोड़ा जा सकता. सो योर कॉन्सेप्ट मस्ट बी क्लियर. सो दिस इज द योर क्वेश्चन. yes, this is your question beta, which had been asked in EMS as well as FMG 2021. You must know the neurovascular bundle. Okay, this is nothing nerve and vessel common bundle. So these are the content. Yes, also you will see the deep fascia is making one partition which is dividing the our arm into the two compartment. Yes, this is the front compartment, entry compartment. This is the back side compartment, posterior compartment. So you will see this front compartment. Suppose this is the front side, so you will say anterior compartment. Suppose this is the back side of the arm, so you will say yes, this is posterior compartment. Yes, every compartment is having their own vein, their own artery and their own nerve. What I want to tell you, every compartment is having their own vein, their own artery and their own nerve, and they are protected with the help of the our modified deep fascia. That is a neurovascular bundle. What I want to tell you, every compartment is having their own vein, artery, nerve. Yes, VAN. And one more basic concept. First session is our basic concept. Yes, we are dealing with our basic concept. What you have to remember, this modified deep fascia. Yes, it is separating the our two compartment. चलो इसका नाम देते हैं. What should be the name? Okay. Yes, you are correct, Dr. Leela. Yes, lymph nodes are also there. Okay, there is a vein, artery, nerve and the lymph node, but we are focusing over the important structures. Okay, VAN formula we must know. You are correct, lymph node is also there. Yes, please commenting, please keep commenting. इसको active बनाना है. Okay. Yes, we are going to talk about the septa. Very nice, Rahul. Very nice, very good. So try to understand. एक पार्टीशन है, डीप फेशिया का एक मॉडिफिकेशन है which is coming from the deep fascia and joined to the our bone. So what you will say, this is in between the muscle, that's why you will say intermuscular. Yes, it is in between the muscle, that's why intermuscular, and it is the partition, that's why you will say septa. Remember, our body is not a single compartment, it is divided into the many compartment. Like the arm, it is having the anterior compartment, posterior compartment. Forearm, when you will do dissection, there is an intermuscular compartment, it will divide anterior compartment, posterior compartment. Yes, our thigh, you will see that your thigh, yes, see here, anterior compartment, medial compartment, posterior compartment. So you will see our body is divided into the compartment. Every compartment is having their own vein, own artery and own nerve. Got the point? Clear everyone? Yes. अब यहां से एक लॉ निकलता है, that is the Hilton law. Try to understand the nerve of the each compartment. It will supply the all the muscles of that compartment. It will supply the joint also. It will supply the skin over that compartment. Again, try to understand. हम देखने जा रहे हैं अगला basic concept. With the help of this concept, every fossa, every boundary, you can say that roof, floor, yes, our medial, lateral, you have to talk about the nearby structure. Always the roof will be formed by, yes, skin, superficial fascia, deep fascia, this all. Fine. So these are the things. Now, go with the our notes. See here, I had drawn this diagram. This is the part. Yes. Can you see? There is our India country. Ganga river is flowing on the our north side. So Ganga will supply the north region. Yes, the Krishna, Kaveri, Godavari, it is on the south side, so it will supply the south area. Getting the point? So remember, जो नदी जहां रहती है, जहां बहती है, उस एरिया को सप्लाई करती है. In the same way, the particular nerve which is flowing in a particular compartment, that will supply all the muscles of that compartment. Okay, getting the point? So these are the different points which you have to remember. Okay, yes. When we do dissection in entry compartment of the arm, there is a musculocutaneous nerve. So this musculocutaneous nerve will supply all the muscles of the entry compartment of the arm. Getting the point? Yes. What are the muscles? B, B, C. B for biceps, B for brachialis, C for coracobrachialis. This all are supplied by which nerve? Answer is musculocutaneous nerve. In the similar way, when you will do dissection on the back side, you will get, yes, there is a triceps. So all the muscles, yes, on the back side, triceps. Which nerve is here? Radial nerve. So all the muscles of the posterior compartment, they will get innervation by the radial nerve. ओके जो नदी जहां रहती है, जहां बहती है, उस एरिया को सप्लाई करती है. सिंपल. Yes, in the forearm there is the median nerve, there is the ulnar nerve. So all the muscles of the front of the forearm, they will be supplied by mainly by the median nerve, partly by the ulnar nerve. Yes, बैक में किसकी नदी बह रही है? बैक में बेटा हमारे रेडियल नर्व की नदी बह रही है. So what you have to remember, the posterior compartment, yes, the posterior compartment, it will get innervation by what? Remember, that is your answer, radial nerve. Okay, again in the thigh we will see, ये बेटा आपका जरूर एक क्वेश्चन आता है. You will see in the thigh, in the front compartment, there is a femoral nerve. So all the muscles of the entry compartment of the thigh, they will get innervation by the femoral nerve. On the medial side there is a obturator nerve. So all the muscles of the medial compartment, ये किससे सप्लाई होगी? obturator nerve से. Again इधर obturator nerve की नदी बह रही है. So obturator nerve will supply all the muscles of the thigh. Yes, medial compartment. Back of the thigh, you know the thickest nerve of the body, sciatic nerve. So the sciatic nerve will supply all the muscles of the back of the thigh. Getting the point? Okay, so these are the your different important points. तो इस बेसिक कॉन्सेप्ट को लर्न करने के बाद अब हम आते हैं अपने कुछ रिसेंट क्वेश्चन में. यस, हु विल से मी द आंसर? दिस इज द फर्स्ट क्वेश्चन. दिस इज द फर्स्ट क्वेश्चन. फ्रंटल प्लेन सेक्शन इज टर्म्ड एज. यस, टेल मी रिसेंट क्वेश्चन. एक क्वेश्चन बेटा आपका जनरल नॉट से आने का फुल चांस. फ्रंटल प्लेन सेक्शन, इट इज टर्म्ड एज. ओके, एनीवन? यस 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 यस. So B, yes, Shiva is correct. Yes, Ashif Khan, Leela, yes, very good, beta. Coronal section. So one question from the our general knowledge. So I am telling you the few point. Can you see? You can follow this PDF. This is anatomical position. General anatomy, one question. Yes, what is the anatomical position, beta? Try to understand. Body is erect. Okay, eyes looking forward. You can see the body is erect. This is the image from the Gray's Anatomy, 41st edition, 42nd edition. Eyes looking forward, both hands hanging by the side, palm directed forward. So this is the ideal position, palm directed forward, then both feet together and toes forward. So this is your, remember, this is your anatomical position. Whenever you are doing surgery, either the surgery or the your obs-gynae procedure, always think about it. अब हमको कटिंग करनी है. So radiology integration, see here, the plane which is dividing the body into the equal right and left half, एकदम एक सेक्शन कटा, एक आरी चली जो बॉडी को एग्जैक्टली राइट और लेफ्ट में डिवाइड कर दी. दिस इज नोन एज मिड सजाइटल प्लेन. गेटिंग द पॉइंट? इट इज नोन एज द मिड सजाइटल प्लेन. व्हाई आई एम टेलिंग यू? क्योंकि बेटा जब रेडियोलॉजी जब होगी, यू विल सी द एक्सरे, सीटी, एमआरआई, देयर विल बी वन टर्म, मिड सजाइटल व्यू ऑफ द ब्रेन, सीटी, एमआरआई. Yes, you will get that point only when you are having the concept of the general anatomy. Next, can you tell me how many mid-sagittal plane are possible? Only one. Now, what is the sagittal plane? The plane which is dividing the body into the, yes, same way. The plane which is parallel to the mid-sagittal plane. That is known as the sagittal plane. Now, what is the coronal plane? This is the question. The coronal plane which is dividing the body into the anterior एंड पोस्टीरियर. सो सपोज एक बेटा एक आरी चली ऐसे और नाक आगे कटा और ये जो ऑक्सीपिटल एरिया है पीछे रह गया. दिस इज कोरोनल प्लेन. दिस इज द फ्रंटल प्लेन दैट हैड बीन आस्क्ड इन द रिसेंट एग्जाम. ओके, फ्रंटल प्लेन जो हमारे बॉडी को फ्रंट में और बैक में डिवाइड करती है. करेक्ट बेटा. नेक्स्ट, देयर इज अवर horizontal plane which is parallel to the ground, the plane which is dividing the body into the upper and the lower part. Complete. Okay, तो यहां से एक क्वेश्चन आने के चांसेस. हिल्टन लॉ मैंने आपको बताया, there are the total 639 muscles in our body. You cannot remember each and every muscle. You cannot remember each and every nerve supply. But this Hilton law will help you. In this PDF you will see. अच्छा, अब यहां पर देखो बेटा, क्या आप गेस नहीं कर सकते कौन सा क्वेश्चन आने वाला है? See here, in FMG 2020, there was the one question. Yes, osteology question. They shown this image and question was asked about this, our pubic symphysis joint, image based question. Now the same question repeated, but they asked with the radiological pattern. Getting the point? बेटा क्वेश्चन वही है, मैनर ऑफ आस्किंग इज डिफरेंट. हम लोग जब थे उस समय क्वेश्चन पूछा जाता था. क्वेश्चन था बेटा, यस, pubic symphysis is which type of the joint. Nowadays the same question is asked with the osteology image, then the same question is asked with the radiological image. इसलिए बेटा ये कहना तो बिल्कुल गलत है कि क्वेश्चंस नए आ रहे हैं. क्वेश्चंस आर सेम, द मैनर ऑफ आस्किंग इज डिफरेंट. गेटिंग द पॉइंट एवरीबडी? ओके, सो व्हाट यू हैव टू रिमेंबर, दिस इज द जॉइंट. तो बेटा एक क्वेश्चन जनरल एनॉट से, एक क्वेश्चन जॉइंट से. डोंट नेग्लेक्ट द जॉइंट. दिस इज द क्लासिफिकेशन. Yes, because it is a rapid revision class, that's why I'm just telling you in fast way. See here beta, what is the joint? Try to understand the junction between the two bone. Suppose this is the one bone and it is the another bone. Getting the point? So the junction between two bone, if it is filled with the fibrous connective tissue, then it is fibrous joint. Agree? Yes. Junction between the two bone, yes, these are the two bones. And the junction between two bones, if these are filled with the cartilage, then it is the cartilaginous joint. Simple. Yes, junction between two bones, yes, there are the two bones, and these are covered with the fibrous capsule, and within this fibrous capsule there is our synovial fluid, then it is synovial joint. Simple. Yes, it is your fibrous joint. Then you can see this is the cartilaginous joint, and then here you can see this is your synovial joint. Everybody getting the point? Okay, yes, joint is our junction between two bones. So here is the one list for all of you. Okay, yes, can you follow here? Yes, fibrous joint. I'm just making summary, otherwise in detail class we teach all the points. Yes, see here, fibrous joint, again it is three type. Your mnemonic is Sasuji. You know, Sasuji, Sasurji. Okay, so Sasuji is your trick. S for sutures, which are found in the skull. Yes, S for syndesmosis, which is found in between the tibia and the fibula at the lower part. And gomphosis, as the name is suggesting, it is found in the gums. Yes, in the same way, cartilaginous joint, it is primary cartilaginous and the secondary cartilaginous. Primary cartilaginous when there is the cartilage. Okay, yes sir, cartilage is there, so cartilaginous. Getting the point? But later it shows ossification, the bone is totally joining together, so no movement is possible. So this is your primary cartilaginous joint. Getting the point? Yes. This is also known as the synostosis because it is showing the fusion. Example, remember, abhi tak kya hai? Yes, our secondary cartilaginous joint had been asked. Maybe primary cartilaginous joint may ask. Remember, the joint between the epiphysis and diaphysis, it is our primary cartilaginous. And once there is a fusion, no growth. So our orthopedics, yes, orthopedics as well as pediatrics as well as our anatomy integration. This epiphysis and the diaphysis, they are having the cartilage. It is the primary cartilaginous joint. Later it ossifies, that's why it is the primary. Okay, and once if it is ossifying, now there is the no further growth of the bone. Height will not increase. आपको पता है ना, हमारी height जो है 18 साल 20 साल 21 साल तक बढ़ती है, उसके बाद नहीं बढ़ रही है. Why? Because this is getting fusion. Yes, growth hormone activity, our medicine topic, integration. Okay, so remember this all the points. Now we are looking secondary joint. Better remember, joint से एक question जरूर आ रहा है. Don't neglect this topic. Secondary cartilaginous joint. Yes, when it is not ossifying but partial movement remains there, then it is our secondary cartilaginous joint. Yes, there is our cartilage, but it is not ossifying. You can remember with the mnemonic SYM. S for symphysis pubis, I for intervertebral disc, M for manubriosternal joint. Okay, these all are the midline joint. I am showing you with the three-dimensional way. See here beta, Yes, can you see? Yes, can you see? This is our vertebral column. तो इस vertebral column में आप यहां पर देख रहे हैं this all the bluish color structure, all this bluish color structure, these are your, remember, it is our intervertebral disc. This is the example of secondary cartilaginous joint. Okay, now try to understand other midline joint. Can you see? This is the sternum and the manubrium. So topmost part is the manubrium and it is the body. So the junction between the sternum and manubrium, it is also the midline joint. It is the secondary cartilaginous. And now see here the pubic symphysis, which is frequently asked. See here this pubic symphysis, three-dimensional orientation. Yes, 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 very good. Intervertebral disc. Yes, Shatabdi, Shiva, Shoaib, Dr. Shoaib. Yes, very good. Can you see this is also at the midline? It is having the our cartilage, fibrous. Yes, you can see it is the cartilage. Fine, and it will not ossify. So partial movement will be there. Remember, never forget. SIM. SIM is your mnemonic. And there are the other joint. Yes, you can see the synovial joint, you know very well, ball and socket, our shoulder joint, hip joint. Yes, saddle joint, base of the thumb. Yes, condylar or bicondylar, our knee joint, the most complex joint. Ellipsoid joint, yes, wrist joint is the our ellipsoid joint. Hinge joint, yes, our elbow joint is the hinge joint. Pivot joint, very important. Atlantoaxial joint, no movement, it is our, remember, pivot kind of the joint. And there is a plain synovial joint. Remember, the plain synovial joint is found in between the our ribs and the vertebra. Okay, so this is just quick revision. Fine, you can go for the our detailed videos, okay, where you can see. लेकिन कम से कम जो अभी रैपिड रिविजन में हमको करना वो चीज हमने कवर की. अगेन आई एम टेलिंग यू वन क्वेश्चन श्योर फ्रॉम द जॉइंट. अच्छा एक चीज बताओ, हो सकता है जॉइंट से क्वेश्चन ना आए, लेकिन बोल दो, आप बोल दो कि नहीं सर ये ज्वाइंट टॉपिक हमको ऑर्थो में काम नहीं आएगा, सर्जरी में काम नहीं आएगा. नो, ऑर्थोपेडिक्स without knowledge of the joint, hip joint, shoulder joint, knee joint, you cannot operate. Okay, so remember beta, yes, it is very important. Everyone, all of you getting the point? Okay, एक क्वेश्चन जॉइंट से अगर बाय द वे नहीं आया तो बेटा तब भी इसका नॉलेज आपको ऑर्थो में काम आएगा ही आएगा. You, all of you getting the point? Okay, okay, everybody? Yes. Okay, beta. So now we are going to move for the our upper limb portion. The first portion we had completed. Our first portion we talked about, yes, about the our basic concept, boundaries of all the fossa. We talked about the, yes, our nerve supply, Hilton law, जो नदी जहां रहती है, जहां बहती है, उस एरिया को सप्लाई करती है. We talked about the our joint. Okay, now here in the PDF I had given the synchondrosis, symphysis, this all the differences. Okay, and also there is a creativity box, you can prepare the notes for all of you. Okay, now we are going to talk the upper limb. So what are the different bones in the our upper limb? Okay, yes, thank you everybody, thank you for your response, king of anatomy. Yes beta, I want to say every teacher is best, every author is best. Okay, what is happening, ट्यूनिंग की बात है, जहां स्टूडेंट और टीचर की ट्यूनिंग बनती है तब वहां पर फिर आपको रेजोनेंस मिलता है और एक बेस्ट चीज आपको देखने को मिलती है. सो रिमेंबर, एवरी टीचर इज बेस्ट, एवरी टीचर इज किंग, ऑल आर पुटिंग देयर बेस्ट फॉर यू ऑल. ओके, बस होता क्या है कि किसी को किसी का लैंग्वेज समझ में आता है, किसी को किसी की कहानियां समझ में आती है. एवरी टीचर इज बेस्ट, एवरी स्टूडेंट इज बेस्ट. ओके, सो थैंक यू वेरी मच फॉर योर कमेंट. तो इसी बात पर एक अर्ज हो जाए. यस, तो जब भी हम अर्ज हो जाए बोलेंगे तो आपको कहना इरशाद. ओके, यस, अर्ज हो जाए. Yes, one question, sir, neurovascular bundle is absent in. Yes, this is the question in AIMS. It is absent in the leg, superficial posterior compartment. This is the question. So hope you all are getting the point. Yes, Junaid, thank you beta, thank you for your love and respect. You all are getting, yes, Irshad, yes. So I'm getting your Irshad, so I'm going to do urge. Okay, and remember, my shairis are very katilana. Okay, दिस विल कॉज इपिस्टेक्सिस फ्रॉम ईयर। तो अपने ईयर चेक कर लो, वहां से खून नहीं आ रहा है ना, अगर नहीं आ रहा है सो देन यू आर रेडी, बिकॉज दिस शायरीज विल कॉज इपिस्टेक्सिस फ्रॉम द ईयर। ओके, सो रिमेंबर बॉर्डर मूवी, एक बहुत अच्छी सी मूवी आई थी। ओके, संदेशे आते हैं हमें तड़पाते हैं, कि चिट्ठी आती है कि पूछे जाती है, कि घर कब आओगे, लिखो कब आओगे, कि तुम बिन ये दिल सूना सूना है। वहां पर जैकी श्रॉफ ने एक बहुत अच्छी लाइन कही थी सनी देओल के लिए, सनी देओल ने एक बहुत अच्छी लाइन कही थी जैकी श्रॉफ के लिए। उन्हीं लाइनों को दोहराते हैं, अर्ज किया है, तुम ही तुम हो तो क्या तुम हो, हम ही हम हैं तो क्या हम हैं। इस लाइनों में बहुत ही जान है। ओके, यस 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 यस, हम ही हम हैं तो क्या हम हैं, तुम ही तुम हो तो क्या तुम हो। स्टूडेंट बिना टीचर नहीं, टीचर बिना स्टूडेंट नहीं। ओके, तो बेटा पढ़ने का मजा तो तभी है जब एक टीचर आए। यस, टीचर का नॉलेज बेटा अभी यहां पर है, हमारे भी टीचर थे, वो यहां पर थे, हम स्टूडेंट थे, हम यहां पर थे। एक अच्छा टीचर वो होता है जो खुद को नीचे गिराता है, स्टूडेंट लेवल पर लाता है, और फिर धीरे से अपना लेवल बढ़ाता है, साथ में स्टूडेंट को ऊपर खींचता है, फिर अपना लेवल ऊपर बढ़ाता है, स्टूडेंट को ऊपर खींचता है, फिर अपना लेवल बढ़ाता है और स्टूडेंट को ऊपर खींचता है। और अब एक ऐसा सिचुएशन आता है कि स्टूडेंट और टीचर लगभग एक लेवल में होते हैं। यस, टीचर इज शेयरिंग, टीचर इज ट्रांसफरिंग हिज नॉलेज टू द स्टूडेंट। ओके, अगर हम यहां पर होकर के बात करेंगे तो बेटा बहुत बड़ा गैप होगा, आप ऊपर नहीं उठ पाओगे। रिमेंबर, यस, वी द टीचर, हमारे टीचर ने भी वही किया, हमारे लेवल तक आए। अब ये हमारी जिम्मेदारी है कि हम आपके लेवल तक आए, धीरे से आपको लिफ्ट करें, धीरे से आपको लिफ्ट करें। ओके, फाइन, सो वी आर गोइंग टू डू द सेम थिंग, होप यू ऑल आर लाइकिंग। तो रिमेंबर बेटा, सिर्फ हम ही हम हैं तो क्या हम हैं, तुम ही तुम हो तो क्या तुम हो। स्टूडेंट बिना टीचर नहीं, टीचर बिना स्टूडेंट नहीं। तो मिल करके पढ़ते हैं, मजे के साथ पढ़ते हैं, और कुछ इस तरीके से पढ़ते हैं कि ये चीजें याद रहे। ओके, सो कंटिन्यू कंटिन्यू, सो होप यू ऑल गॉट द पॉइंट। यस यस यस, यो सो थैंक यू एवरीवन। यस, डॉक्टर रामिया मेडिकोस, थैंक यू, डॉक्टर शाहिद रगनार, यस, संध्या तौसीफ इज हियर। Okay, yes, I will make shairis in English also, yes, but that English will be dangerous. Like bullets are walking in the, yes, market. This is the shairi, one line. Can you tell me bullets are walking in the line, इसका मतलब क्या है? इसका मतलब है बाजार में गोलियां चल रही थी। ओके, सो वन फनी थिंग, ओके, बाजार में गोलियां चल रही थी, इसका इंग्लिश में हम शायरी अगर मारेंगे तो कैसा? यस, बुलेट्स आर वॉकिंग इन द मार्केट। सो डोंट वरी, आई विल क्रिएट द जोक्स इन द इंग्लिश ऑल्सो, यू विल मेक द फन। ओके, यस यस यस, सो यस, आगे नाउ वी आर लुकिंग फॉर द अवर upper limb. Yes, see here beta, how to study the upper limb, how to study the upper limb. Yes, first the area in front of the chest, pectoral region. Yes, then you will talk about the shoulder region, then you will talk about the axilla, then you have to talk about the, yes, back region. कैसे पढ़ना upper limb? Pectoral region, shoulder region, then our axilla, then back, then from the shoulder joint up to the hinge joint, up to the our elbow joint, this is the arm. यहां पर बेटा जो बोन है उसको क्या बोलेंगे? ब्रेकियम. So this is also known as the brachium or arm. Opposite to it, antebrachium, also you can say forearm, and this is the your hand. So you will see, yes, you will see the different parts and the muscles. I had given this list, but nowadays beta upper limb, only one question, naws of the upper limb. Naws of the upper limb are they are asked. So we will talk about the naws of the upper limb. Fine. लेकिन कैसे पढ़ना है? Yes, pectoral region, then shoulder region. Repeat with me. Yes, pectoral region, then shoulder region, axilla, back, then arm, forearm, and the hand. Okay, so this is the way how you have to study. Yes, pectoral region, yes sir, scapular region, back. In axilla we have to see our, yes, brachial plexus, then arm, then forearm, and then you will see about the hand. This is the sequence of the upper limb study. Now only one question from the upper limb, so that topic is going to ask from the your neuro portion. So we are going to talk about the neuro directly because it is a rapid revision session. Okay, so try to understand. Yes, see here, just once I'm showing you the three-dimensional anatomy, which is the beauty bone. Can you tell me? The beauty bone. This is the beauty bone. Fine. This is our clavicle. This is known as the collarbone. MCQ. Beauty bone is the MCQ. Collarbone is the MCQ. It is having the shape like the old key. Which bone is known as the key bone? MCQ. Clavicle. Why it is known as the beauty bone? Yes. Deepika Padukone, Alia Bhatt, Ranveer Kapoor, Ranveer Singh, they are having the slim trim figure. So the person who are having the slim trim figure, they are having the more prominent clavicle. They are considered more handsome, more beautiful model. That's why. Okay. So this is your MCQs. Now try to understand further. Which bone is known as the shoulder blade? Yes, MCQ. This scapula is known as the shoulder blade. Magic of three is there. You can go for the detailed videos. There I taught you. There is the magic of three. Yes. Three angle. Lateral angle. Superior angle. Inferior angle. Three border. Yes. Superior border. Lateral border. And there is the medial border. Yes. There are the three bony processes. What are the three bony processes? Yes. You can see. This is the crobic-like process. Coracoid process. This is the crobic. कौवे की चोंच की तरह दिख रही है. इसलिए इसको कोराकॉइड कहते हैं. Yes, you can see the bony process which is at the top. At the top, this is your acromion process. कहीं पर भी acro word use हुआ, acro का मतलब होता है बेटा top. Okay. Now try to understand our one another bony process, that is the spine. Can you see? Screen पर पूरी एक लंबी सी bony process रन करते हुए नजर आ रही है. This is the spine. Above the spine, supraspinous fossa. Below the spine, infraspinous fossa. And you can see this is the subscapular fossa. Three angle. Three border, three fossa, three process. Magic of three dedicated through the scapula. Now, can you see next osteology quick revision session? Yes, this is our humor bone. Yes, it is our humor bone. Remember, this is our humor bone. This is the funny bone. Because it is the funny, that's why it is known as the humor bone, humerus. Getting the point? Okay, why it is known as the funny bone? Because ulnar nerve passes behind the medial epicondyle. So when this ulnar nerve is getting stimulation, there is a current like sensation. Getting the point? So this is your humor bone, humerus. Now you all know that on the lateral side there is a radius, and on the medial side there is the ulna. And then carpal bone, you know, she looks too pretty. Try to catch her. Yes, scaphoid, lunate, triquetral pisiform. Then you will see the trapezium, trapezoid, capitate, hamate. MCQ, this pisiform bone is the seed-like bone. Can you see? Beautiful. Yes, this is the seed-like bone. बीज की तरह दिख रहा है. The seed-like bone, they are known as sesamoid bone. This is the pisiform bone, which is ossified in flexor carpi ulnaris. MCQ, this pisiform bone is ossified in the flexor carpi ulnaris tendon. Yes, Dr. Ria, you are correct. Beta, Ridge, you are correct. Yes. You all are. Yes, it is mutter-like. Very good, very good. Yes, Dr. Arman, you all are correct, beta. Very nice. And then you will see our different metacarpal bones. Yes, sir. There are the 1, 2, 3, 4, 5 metacarpals, and then phalanges. Can you see? First two are 2 phalanges. Then you can see 1, 2, 3. Only the thumb is having the 2 phalanges. Rest all are having the 3 phalanges. Got the point? So this was the quick revision for our bones. Now I am showing you the different muscles. See here, what are the different muscles at the pectoral region? Here you can see. You are starting the dissection. In the pectoral region, there is the skin, then superficial fascia. Within the superficial fascia, you will get breast. MCQ. Breast is located in superficial fascia. Getting the point? Yes. Now try to understand, when you will do dissection, one big muscle is seen. Okay, because it is in the pectoral region and it is big, that's why it is pectoralis major. Getting the point? Yes. Now try to understand. Okay, शेक्सपियर ने कहा है नाम में क्या रखा है, अर्ज किया है. यस. तो फिर से एक शायरी आप लोगों के लिए जो आपको पढ़ाई लिखाई में स्टडी में हेल्प करेगी. शेक्सपियर ने कहा है नाम में क्या रखा है, बट रिमेंबर मियां गालिब कहते हैं सारे राज नाम में दफन रहते हैं. ओके, सो गेटिंग द पॉइंट व्हाट आई एम टेलिंग यू. यस. थैंक यू फॉर योर इरशाद, थैंक यू फॉर योर वाह. यस, फैजान, हेमंत, डॉक्टर प्रियंका, शिवा, शमीरा, थैंक यू एवरीबॉडी, थैंक यू. व्हाट आई वांट टू टेल यू, जितनी भी चीजें हैं बेटा नाम में है. ब्रेक द नेम एंड गेट द आइडिया. यस, व्हाट इज द नेम? Pectoralis Major. Yes, it is situated in the pectoral region and it is big. I'm showing you here the muscles. Yes, try to understand. Can you see? Can you see this one? Yes, we are looking this muscle. Can you observe? This muscle is located at the pectoral region. Look at here. Yes, this muscle is located at the pectoral region. Yes, it is located at the pectoral region and it is very big muscle. That's why what should be the name? Pectoralis Major. It is the climber's muscle. Two muscles are climbers, Pectoralis Major and Latissimus Dorsi. Yes, can you see? जब हम इसका dissection करेंगे तो एक छोटी muscle मिली. What should be the name? It is in the pectoral region. It is small, so pectoralis minor. Remember, these pectoral muscle are supplied with our lateral pectoral nerve and medial pectoral nerve. Lateral medial pectoral nerve, two nerves. Because these are having the two nerves, that's why these are hybrid muscle. MCQ, yes, these are known as hybrid muscle. Now, also, जब आप इसको देखेंगे बेटा तो ये आपको क्या मिलेगी? This is our one muscle, tooth-like having appearance. So it is serratus. It is coming front. That's why anterior. So this is serratus anterior. Yes, it is boxer's muscle. If there is a paralysis, there is the winging of scapula. Next, एक छोटी सी muscle है. You can see this one is small muscle. This is very small muscle below the clavicle. तो क्या नाम होना चाहिए? Subclavius. So can you tell me the four muscles? First, pectoralis major. Second, pectoralis minor. Third is your, yes, serratus anterior. And fourth is your, remember, that is our subclavius. So these are the main point. Try to understand how the questions had been asked. Can you tell me this question? So here is the recent question, FMG 2020. Yes. One question, there is the elevation of the medial border of the scapula. Can you tell me what is this? Which muscle is parallel? Now comment the answer. Yes. A, B, C, D. After overhead weight lifting. Okay. उसने क्या किया? Overhead abduction किया, weight lifting की. Okay. Now there is a following deformities where the medial border of the scapula is elevated. It is very repeated question. So answer is yes. Many students, Shiva, Devi, Leela, Abhijit, Medico. Yes, Dr. Shiri. Yes, you all are correct. Answer is Siri. Yes, answer is C. Serratus anterior. Yes, see here. This is the serratus anterior muscle. It is holding the medial border of the scapula. I am showing at the 3D model. Can you see? This muscle is coming and it is getting insertion into the scapula. Where? Along the medial border. You can see it is going inside and it is getting insertion along the medial border of the scapula. So it is pulling the scapula, medial border on the front. You can see on the medial side of the scapula. So if it is getting paralysis, then medial border of the scapula is getting elevation. That is our winging of scapula. Yes, remember, one nerve is supply which is running in thorax with the long course. So this is nothing, it is our long thoracic nerve. Yes, it is our long thoracic nerve. Remember, it is long thoracic nerve. This nerve was studied by the one anatomist known as Bell. That's why it is known as the Bell's nerve. Remember, this Bell's nerve supplies the which muscle? Yes, boxer's muscle. MCQ. Getting the point? Okay. Yes. So these are the points. This muscle contract and it brings the scapula forward. So it is the protractor of the scapula. MCQ, it is the protractor of the scapula. Yes. Thank you for your wow. Thank you for your comment. Vipul. very thankful बेटा. Yes, जब आप लोग के कमेंट्स आते हैं, जब आप लोग का एप्रिसिएशन मिलता है, तब हम टीचर को एक बहुत ही अलग तरीके की बूस्ट अप मिलती है. सो प्लीज कमेंट दिस ऑल, प्लीज गिव द फीडबैक फॉर यू सो दैट वी कैन डू मोर सेशंस फॉर ऑल ऑफ यू. yes, thank you everyone. So this is the boxer's muscle. Yes, it causes the forward movement of the scapula. That's why it is protractor of the scapula. Getting the point? Fine. Now try to understand after this all. See here, there are the scapular region muscle. What are the scapular region muscle? Hope you all are aware. There is the one delta shaped muscle, deltoid. Then SITS, sits muscle. These are our, yes, just once showing, I'm showing to all of you. Yes, these are the different muscles. You can see this is the delta shaped muscle, deltoid, supplied by the axillary nerve. You can see this is the above the spine of scapula. because it is above the spine of scapula. So what should be the name? Supraspinatus. Remember, मियां गालिब ने कहा है, गालिब मियां कहते हैं सारे राज नाम में दफन रहते हैं. इट इज सुप्रास्पाइनेटस. सुप्रा प्लस स्पाइनेटस, क्या नाम है इसका? सुप्रास्पाइनेटस. It is above the spine of scapula. That's why you will say supraspinatus. Getting the point? Now there is the another muscle which is infraspinatus. Yes, there is the another muscle which is rounded. Rounded को हम इंग्लिश में कहते हैं teres, and it is a small muscle, that's why minor. And then you will see there is a one muscle which is in subscapular fossa, subscapularis. These are rotator cuff muscle. These are dynamic stabilizer of the shoulder joint. Getting the point? Yes, these are the points. Yes, if there is an injury in this rotator cuff, that is a rotator cuff injury, orthopedic integration, rotator cuff injury. Yes, which muscle is most commonly ruptured? जो सबसे पतली है, कौन सी? Supraspinatus. So in ortho you will see the supraspinatus tear syndrome. MCQ, which muscle is known as the forgotten muscle of the shoulder joint? Remember, subscapularis, because this subscapularis muscle is very thick, hybrid muscle, multipennant muscle. तो बेटा ये आसानी से रप्चर नहीं होती. सो द डॉक्टर्स दे आर स्किपिंग, दे आर नेग्लेक्टिंग दिस मसल. दैट्स व्हाट इज नोन एज द फॉरगॉटन मसल ऑफ द शोल्डर जॉइंट. MCQ. Which muscle is not the component of the our rotator cuff? Answer is the teres major. Yes, yes, yes. Dynamic stabilizer. Yes, correct. You all are correct, beta. Every word, my every line is MCQ. Okay. There is the largest bursa of the body. That is the our subscapular bursa. So you will see the largest bursa of the body, that is subscapular bursa. Yes. What is the bursa? Bursa is the small pouch of the synovial fluid. Yes, integrating with the orthopedics. What is the bursa? Bursa is the small synovial fluid which has been separated from the main synovial cavity. और इस bursa के ऊपर हमारे बॉलीवुड में खूब सारे गाने बने हैं. So can you tell me any song which is dedicated to the bursa? Any song which is dedicated to the bursa? MCQ. हर जोक में कोई ना कोई MCQ है बेटा. Fine? Getting the point? Yes, yes, yes. Any song which is dedicated to the bursa? Yes, yes. Dr. Prashant is correct. Tip tip बरसा पानी, पानी ने आग लगाई, समथिंग लाइक दैट. इसमें पीले कलर की साड़ी पहन करके हीरोइन बोल रही टिप टिप बरसा पानी. मतलब समझो, ऑर्थोपेडिक्स की नजर से देखो, ऑर्थोपेडिक्स इंटीग्रेशन, टिप टिप करके बरसा से साइनोवियल फ्लूइड बरस रहा है तो पानी में आग लगा दो. अरे भाई, बरसा से लीकेज हो रहा है, साइनोवियल फ्लूइड लीक हो रहा है, ऑर्थोपेडिशियन के पास जाओ, इलाज कराओ, पानी में आग लगाने की क्या जरूरत है? ऐसे ऐसे तो गाने बनते हैं. आई एम जस्ट जोकिंग. ओके, यस, दिस इज द बरसा. एनी मोर सॉन्ग? एनी मोर सॉन्ग? यस 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 यस. एनी मोर सॉन्ग? यस. मोहब्बत बरसा देना तुम के सावन आया है. ओके, इसमें लवर जो है वो कहता है कि हमको तुमसे मोहब्बत हो गई इसलिए तुम अपना बरसा दे दो. आई एम मेकिंग फन. ओके, अरे भाई प्यार हुआ है, दिल लो दिल दो, बरसा क्यों मांग रहे हो? ओके, सो जस्ट मेकिंग अ फन. बट यस यस, बरसों रे मेघा मेघा, बरसों रे मेघा. अरे भाई, बरसा से पानी नहीं टपकाना है, पूरे ज्वाइंट की ऐसी की तैसी हो जाएगी. सो मेकिंग द फन. बेटा इस बरसा को याद रखना. क्यों? क्योंकि जहां बरसा वहां बरसाइटिस. गेटिंग द पॉइंट? Itis means inflammation integrating with your pathology. Rubor, tumor, dolor, calor, functionalisa. That is your pathology. Virchow ने ये चीजें दी थी. Yes, you know, Celsus ने ये 4 कार्डिनल फीचर दिए थे पैथोलॉजी का MCQ. Rubor means redness, tumor means yes, there is a swelling, dolor means pain, calor means heat. Fifth component was added by the Virchow's pathology integration beta, functionalisa. तो bursitis. So this bursa, subacromial bursa is getting inflamed. Orthopedics की हम बात कर रहे हैं. So there is a subacromial bursitis which is positive with the Dauber sign. Look in your orthopedics. The patient is coming. When he is elevating the arm, pain disappear. When dropping the arm, pain appears. Okay? So you will see in orthopedics. But remember, this is important. Okay? Now, yes, yes, Dr. Saab. यस यस. सो डॉक्टर्स क्लब इज कमेंटिंग. फर्स्ट टाइम आपकी क्लास ली है, नॉट की आपके समझाने का तरीका एक नंबर है. थैंक यू बेटा, थैंक यू सो मच. आप ऐसे कमेंट हमको भेजते रहिए. अगर आपके ऐसे पॉजिटिव अप्रिशिएशन मिलेंगे तो नर्सिंग नेक्स्ट NLC पर मैं आप लोगों के लिए और आता रहूंगा और आप लोगों के लिए क्लासेस होते रहेंगी. ओके, यस. सो थैंक यू वेरी मच. ऑल्सो यू कैन गेट कनेक्टेड विथ मी डॉक्टर श्रीकांत वर्मा क्लासेस. यस, देयर यू विल गेट द मेनी फ्री वीडियोज जिसमें चीजें आराम से आपको समझाई गई हैं. यू विल गेट. ओके, माय एवरी सोशल मीडिया इज डॉक्टर श्रीकांत वर्मा क्लासेस. ओके, सो नाउ अगेन व्हाट यू हैव टू सी द बैक रीजन। अब हम बैक रीजन की बातें करते हैं, तो बैक रीजन में जब आप जाएंगे तो आपको क्या क्या चीजें नजर आएंगी। सी हियर वी आर लुकिंग द बैक एरिया। सो व्हेन यू विल सी द बैक एरिया देयर इज अ वन मसल trapezius. Getting the point? Yes. This is the triangular muscle which is supplied by the spinal accessory nerve. Yes, you know, अभी एक मूवी आई थी पुष्पा, झुकेगा नहीं साला, ओके यू नो। तो उस मूवी में क्या था, हमारे जो हीरो अल्लू अर्जुन थे उनके एक शोल्डर नीचे थी, क्यों? दिस इज द कॉज बेटा। हॉलीवुड, बॉलीवुड, टॉलीवुड सब कहां से आते हैं? हमारे एनाटॉमी से आते हैं। सो ट्राई टू अंडरस्टैंड दिस मसल वाज गेटिंग पैरालाइज्ड। व्हिच मसल? ट्रेपेजॉइड शेपेड मसल ट्रेपेजियस, इट वाज गेटिंग ड्रॉप। Why? क्योंकि 11th cranial nerve का डैमेज हो गया था। इट इज सप्लाइड बाय द स्पाइनल नर्व, 11th cranial nerve. So पुष्पा झुकेगा नहीं साला. Yes, he was getting injury in the 11th cranial nerve. So one trapezius is getting drooping and another trapezius, yes, it is getting high. So this was the his dancing movement, Shrivalli, something like that. Okay. दूसरा, आप बेटा ऑर्थो से इंटीग्रेट कीजिए हाई शोल्डर सिंड्रोम. यस, पुष्पा वाज हैविंग द हाई शोल्डर सिंड्रोम. व्हाई? This is known as the Sprengel's deformity, congenital high scapularized form. So these are the things wow, who you can how you can integrate with your Hollywood, Bollywood, Tollywood, and you can make anatomy interesting. Anatomy बेटा इंटरेस्टिंग है, आप भूलना चाहे तो भी नहीं भूल सकते. पढ़ने का नजरिया आपका अलग होना चाहिए. Okay, so what you have to remember? Yes, this is the trapezius. Now hiding this one, can you see this is the very wide muscle, lata muscle, Latissimus Dorsi. This is the Latissimus Dorsi. Remember, it is very wide muscle. That's why it is used for the muscular graft. Yes. Now you will dissect this one. You are getting at the back one muscle which is responsible for the elevation of the scapula, levator scapulae. You will get one muscle which is rhomboid in shape, small. That's a rhomboid minor. ये मसल है बेटा rhomboid शेप की है लेकिन बड़ी है, so you will say rhomboid major. Yes, lady between two major, you must know lateral major is the pectoralis major, medial major is the teres major, and at the floor there is the our yes latissimus dorsi. So these are the different muscles. Now see here we are looking the arm muscle. तो अब हम arm muscle की तरफ आ रहे हैं. I told you arm is divided into the two compartment, entry compartment and posterior compartment. So you can see in the entry compartment this is the biceps because it is having the two head, long head and short head. Getting the point? And then you will dissect this biceps, then you will see the brachialis. एक मसल है जो ब्रेकियम में है, आर्म में है, इसलिए brachialis. Now you will dissect this one and you will get one another muscle. This is coming from the coracoid process inserting into the brachium. So it is known as the coracobrachialis. Getting the point? Yes, this is our coracobrachialis. जब हम डाइसेक्शन करते हैं, हिल टर्न लगाते हैं, ड्यूरिंग द डाइसेक्शन यू विल गेट वन नर्व इज रनिंग इन द एंट्री कंपार्टमेंट ऑफ द आर्म. इट इज सप्लाइंग द मसल एंड देन इट बिकम्स क्यूटेनियस. इट इज द क्वेश्चन ऑफ द नीट 2020-21. अगर कुछ बच्चे नीट के स्टूडेंट के बैठे हुए हैं तो बेटा उनके लिए musculocuteus nerve was asked. This nerve is running in the front of the our arm, then it becomes cutaneous. It is being the लैटरल क्यूटेनियस नर्व ऑफ द आर्म. बेटा ये आर्म के लैटरल पार्ट की स्किन को सप्लाई करेगा. दैट्स व्हाई इट इज नोन एज द लैटरल क्यूटेनियस नर्व ऑफ द आर्म. Okay, so now what I want to tell you, these all the muscles BBC, they are supplied by the musculocuteus nerve. Why? Our trick, our concept, जो नदी जहां रहती है, जहां बहती है, उस एरिया को सप्लाई करती है. क्योंकि यहां पर कौन सी नदी बह रही है? musculocuteus nerve is flowing here, so it will supply all the muscles of the entry compartment of the arm, biceps, brachialis, coracobrachialis. खत्म. Okay, now we are going to talk about the posterior compartment of the arm. So when you are looking the posterior compartment of the arm, there is the one muscle which is having the three head, long head, there is a medial head, there is a lateral head. Yes, you know, जब हम जिम जाते हैं तो हम ट्राइसेप्स बनाने के लिए ऐसे 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 एक्सरसाइज करते हैं. Yes, on the back side there is a triceps muscle, and when you will do dissection at the back side there is the radial nerve. So radial nerve will supply all the triceps muscle. Getting the point? Now try to understand. Yes, try to understand the further more things. There is our muscles of the forearm. Now see here, this forearm is divided into the two group. Yes, superficial group, deep group. Okay, the front of the forearm, superficial and deep. In the similar way, deep part, posterior part, it is also divided into the our superficial and deep group. So here you can see this forearm muscle. बेटा मसल के ऊपर क्वेश्चन नहीं आ रहे हैं, नर्व के ऊपर आ रहे हैं, बट जस्ट वन आइडिया. दिस इज द फोर आर्म, देयर इज अ सुपरफिशियल ग्रुप एंड डीप ग्रुप. ऑल द सुपरफिशियल मसल्स, all the entry compartment muscles, they are taking origin from the medial side of the humerus. Getting the point? Okay, so these muscles are crossing from the front to the elbow, crossing from the front to the wrist, crossing from the front to the fingers. Okay, so when this muscle will contract, जब ये muscle contract करेंगे तो क्या होगा, हाथ ऐसा जाएगा. There is a decrease in the angle of the joint. Decrease in angle of the joint is known as flexion. General anatomy, one question. So this anterior compartment is known as flexor compartment. This medial epicondyle is known as common flexor origin. And in the similar way, yes, remember this our lateral part. Yes, what I want to tell you, this lateral part, lateral epicondyle, feel here, अपने body में पढ़ो बेटा, lateral epicondyle, it is giving the different muscles, it is crossing the elbow joint from the back, it is crossing the wrist joint from the back, it is crossing the fingers from the back. So when this muscle will contract, it will cause in this way, in this way, in this way. Yes, there is an increase in the angle of the joint. Yes, there is an increase in angle of the joint. Increase in angle is known as extension. That's why the posterior compartment is known as the extensor compartment, and this lateral epicondyle is known as common extensor origin. Okay, everybody getting the point? Everyone? Yes. Hope you all are getting the point. Yes. तो ये basic rule आपको याद रखना है. Decrease in angle, flexion. Increase in angle, that is the extension. So in flexor compartment, you can see 5 superficial muscle and 3 deep muscle. So what are the superficial muscle? I am showing you. Try to understand. पहली muscle, this is our pronator teres. बेटा जब क्लास होती है तो मैं इसे ड्रॉ करके बताता हूं, बट राइट नाउ दिस इज द रैपिड रिवीजन. ओके, आप मेरे YouTube चैनल पर जाकर के देख सकते हैं, वहां पर हमने इसे स्केच पेन से हाथ में ड्रॉ करके बताया हुआ है. अभी यहां पर स्केच पेन नहीं है, सो आई एम नॉट एबल टू टेल यू. ओके, बट इवन यू कैन गो एट YouTube चैनल. तो पहली मसल निकली बेटा, कॉन्ट्रैक्ट की, तो ये हाथ को ऐसे डाउन मूव की, सो इट इज डूइंग डाउन मूवमेंट. सो डाउन मूवमेंट इज प्रोनेशन. सो दिस मसल इज नोन एज द प्रोनेटर टेरेस. चलो आगे रिवाइज करो बेटा. यस, हमने ये पहली मसल देख ली. Can you tell me what should be the name of this muscle? चलो रिवीजन करो. This is coming from the flexor point. That's why known as flexor. It is going towards the carpal bone. That's why known as the carpi. It is going towards the radial side. That's why known as the radialis. तो ये जो 3-dimensional orientation है, ये आपको आइडिया देगा कि किस तरीके से आप कैडावरिक इमेजेस को समझ सकें. कभी भी कैडावरिक इमेजेस आ रहे हैं, फॉर द कैडावरिक इमेजेस यू हैव टू लुक द above part origin, you have to look the below part insertion. So that will help you. Now try to understand next muscle. Yes, can you tell me what should be the name of this muscle? This is coming in the palm with the very long course, so it is the palmaris longus. Okay, can you see? It is making the flat tendon, and flat tendon is known as the aponeurosis. Okay, so this is the palmar aponeurosis. Ortho and the medicine integration in rheumatoid arthritis. In connective tissue disorder, there is the fibrosis. Yes, in chronic alcoholic patient, it is getting fibrous and there is a turning of the finger. So this is our, yes, Duplitron contracture. Getting the point? Yes. Orthopedics better. This muscle is having the very long tendon, so you will use this muscle for the tendon grafting operation. Okay, so hope you all are getting the point. Yes, can you tell me further things? Everybody, you all of you getting the point? Just give me the thumbs up. Yes, Gayatri is giving the thumbs up. Yes, beta. Yes, Hemant, thank you. Okay. Yes. Okay, beta. Okay, fine. Okay, beta. Yes. Okay, so we are going to talk about our next muscle. Can you tell me what should be the name of this muscle? Please try to answer. It is coming from the flexor point. It is going to the digits. It is above. That's why it is flexor digitorum superficialis. Fine. Yes. Thank you everyone for your thumbs up, for your yes, for your fires, for your dancing movement in the chat box. Thank you everyone. Okay. Yes. So this is our palmaris longus. Here is the flexor digitorum superficialis. This is our another muscle. Can you tell me what should be the name of this muscle? It is going to the our pisiform. So this is the our flexor carpi ulnaris. Okay. Yes. Now we are talking about the deep muscles. When you are hiding this all, Then you can see one more muscle. It is coming from the flexor point and going to the digits up to the tip. Remember, this is a flexor digitorum, deep muscle, that's why profundus. Yes, you can see there is our different more muscles. Yes, we are hiding this one. Can you see this muscle? It is flexor muscle which is going to the thumb. Thumb means pollicis. Thumb means pollicis. Okay. So remember, this is our flexor pollicis. It is long muscle going to the thumb. That's a flexor pollicis longus. Okay. Next, see here. Can you give me the name of this muscle? This is the quadrangular muscle. That's why quadratus. This is the quadratus muscle. Yes. When this muscle will contract, it will pull the thumb downside. So it is a pronator. Okay. Pronation movement. That's why pronator. It is quadrangular in appearance. That's why quadratus. Getting the point? Okay. So these are our different points. Now try to understand our nerve supply. Yes. Here is the nerve. Which nerve? Our median nerve. So all these muscles are supplied by median nerve except जो नदी जहां बहती है, जहां रहती है, उस एरिया को सप्लाई करती है नियर दिस फ्लेक्सर कार्पाई अल्नेरिस. इट इज हैविंग द अल्ना वर्ड. सो इट इज सप्लाइड बाय द अल्नर नर्व. MCQ. No need to mug up. Just simply apply our Hilton law. And in the similar way, the deep muscles are supplied by the deep branch of the median nerve. That is our anterior introitious nerve. So these all are supplied by anterior introitious nerve. One MCQ, that flexor digitorum profundus is having the double nerve supply. I will teach you. Lateral half by the median nerve, medial half by the ulnar nerve. So it is known as the hybrid muscle. MCQ. Now we are talking about our posterior compartment muscles. So here is the anaconus, brachioradialis, ECRL, ECRB, extensor digitorum minimi, and extensor carpi ulnaris. Okay. See here. You can see this is the back side. Triangular muscle, anaconus. It is example of the screwing muscle. One MCQ. Then there is one muscle which is coming from the brachium going to the radius. So it is a brachioradialis. Yes, this one is the brachioradialis. This is the brachioradialis. Brachium to the radius. Now see here. This muscle is coming from the extensor point. That's why extensor going towards the carpal bone, towards the radial side. That's why extensor carpi radialis. It is very long. That's why longest, ECRL. Now we are dissecting this one and looking for the next muscle. Yes, it is coming from the extensor point, going towards the radial side. It is small. That's why extensor carpi radialis brevis. Next muscle is going towards the digits. That's why it is extensor digitorum. Next muscle is going towards the little finger. So it is extensor digiti minimi. And next muscle is going towards our ulna side. So it is extensor carpi ulnaris, which is the nerve of the posterior compartment. Remember, it is our radial nerve. The deep branch of the radial nerve is the better answer. That is the posterior introitious nerve. Okay. Now you can see the 5 deep muscles of the posterior compartment. One is causing abduction of the thumb. That's abductor pollicis. It is a long muscle. That's why longus. Next muscle is our extensor. Yes, it will cause extension of the thumb. So extensor thumb, that's why pollicis. A small muscle, that's why brevis. And there is the extensor pollicis longus, which is long muscle. So these are the 3 muscles of the anatomical snuff box. एक टाइम था जब यहां से काफी क्वेश्चन आया करते थे. Try to understand, when we are extending the thumb at the base, you will see one triangular depression. Yes, this was used for the snuffing of the drug abusing substance. So remember, this is known as the anatomical because it is in our anatomy, it is in our body. It was used for the snuffing of the drugs. That's a snuff box like structure. So which structures are making the boundary of the anatomical snuff box? 3 muscles: abductor pollicis longus, abductor pollicis brevis, and extensor pollicis brevis. Yes, supinator. I am showing you the supinator muscle which is at the depth. Yes, you are removing this all the muscles. So after removal of this all the muscle at the depth, you will see one muscle. Can you see this rounded muscle? when this muscle will contract, it will cause supination. That's why it is supinator. And one last muscle which is responsible for the extension of the index finger, that is the extensor indices. Okay, so just one idea. You know one funny way? You know, Spider-Man is doing this one, something like that. Spider-Man is not making the webs in this way, or in this way. You know why? Anatomy is the answer. Spider-Man जब जाल बिछाता है तो इस तरीके का मूवमेंट करता है. See here, index finger, it is having the extensor indices. Yes, it is having the extensor digitorum. Yes, it is having the extensor digitorum. Index finger is having the two extensor. In the similar way, our little finger is having the extensor digiti minimi as well as extensor digitorum also. So only two fingers are there who are having the extra extensor. So it is very easy to extend the index finger. Anatomy in your own body. Okay. Yes, it is easy to extend the little finger. Do it. तो आप इसे extend कर सकते, इसे extend करते easily. But it is difficult to extend this middle finger. It is difficult to extend this ring finger. These are not straight. तो Spider-Man को सबसे comfortable ये है. Okay. So why the Spider-Man is doing this movement? Why the yo-yo honey sing? Yes. Okay. Yo-yo honey sing is doing this movement. Why? Because these two fingers are having extra extensor. So hope you all are getting the point. This is the one way how you can remember the anatomy. Now, try to understand what are the different hybrid muscle. So I had made one mnemonic for you. BSPFF. Yes. बहुजन समाज पार्टी कौन ज्वाइन किया? फूफा जी ज्वाइन किए. So one joke for all of you. Okay, एक जोक हो जाए. Yes, so this is the one way how you can remember. So yes, Ashif, hope you all are enjoying. Okay, तो एक जोक हो जाए. जोक ऐसा है, एक लड़की थी. जैसा कि आपको पता है कि क्लासरूम में कुछ भी नाम रख दिया जाता है. तो एक लड़की थी, उसका नाम रख दिया क्लास